Yeah, totally different concept than Western.
Very, very different, but it's very interesting, and it's great because it's holistic. So you take the whole person into it. You know, you don't just check their testosterone level. You know, you're checking everything to help balance them out. So the point we would use for that, for deficiency, if everything's dropping down, everything's, you know, not like everything's not where it should be. We actually use a point on the top of the head. We use a point called do 20. So if you press the point at the top of your head, if you're feeling tired, right on the top of your head, you press that point, it helps bring the energy up. It makes you feel lifted. Give you a little energy boost. So it's right there on the top of your head, right there. So you could just press, you could rub, you could press and release.
And how long do you do that for?
You can press and release. You can do that for about 30 seconds. And it just gives you a little boost. So that's another fun thing you can do. That's actually effective. It's very effective. So if you're feeling tired, you know, you just second, you know, no one even knows what you're doing. You just put your hand in your head and just start pushing down, and you'll give yourself a little boost because you are accessing a point there. Now, we just went over 6 of the 8 principles. So the last 2 principles are yin and yang. Yin and yang actually encompass those 6 principles that we just went over. So do you know the difference between yin and yang? Because you know a lot. I know that.
No. I'd rather have you do everything. Okay, so listen to you.
So if we do yin and yang, everybody's heard of that, right? What it is just opposites. That's what we're talking about. So if we're talking about hot, hot is yang. Yin is cold. Yang is excess. Yin is deficient. Yang is external. Yin is internal. And so it's just, you're just talking anything you could name. We name the opposite, and that's either yin or yang. Yang is up. Yin is down. Yang is, you know, like we said, testosterone. Yin is estrogen. So that's what you're talking about when you're talking about yin and yang. So when you use these yin and yang to diagnose, like I said, you know, we're using a lot of things, a lot of opposites here. So if you think about yin and yang with hormones, if we think about infertility, which a lot of people come in for, if a woman comes in and she's very thin, let's see, she's thin, she has a quiet voice, and she tends to be cold. Do you think she's more yin or more yang? Does anybody have an idea?
Yin.
Yin, that's right. So she would be actually a yin deficiency. That's what we would say. She'd be a yin deficiency. She's thin, she's cold, she's quiet. She's a yin body type, we could say. Same thing if someone is very voluptuous, and she's infertile, right? So now we have someone who's infertile also, because she comes in and she's very voluptuous, she's loud, she tends to be hot, and she's infertile. She would be more of a yang body type. So yin and yang encompass the other 6 principles, but you know, but you can separate them into each pattern. Now, these principles are very simple and very basic, but there are endless combinations of what they can be, because it is typical for a patient to come in and have hypothyroidism, which is cold, menopause, which is hot, stress, which is excess, and maybe they're tired all the time, which would be deficiency. So they have that, and maybe to top it off, and those, like we said, are all internal patterns. To top it off, they have a cold. Now it's external. So they have all of this, and they come in. And so what do? We combine all these points. We mix, we talk to them, we find out more about what's going on, and maybe they're not super skinny or the big voluptuous woman. Maybe it's the middle of the road body type. So when you do come to diagnose, it gets to be very difficult, because there are so many patterns within a person, and you really have to figure out what is going on and what point you're going to pick to treat. So that's kind of a little spiel on hormones and Chinese medicine. But if you'd like, I can give you a little acupuncture treatment now to.
Yeah, I have visuals.
Yeah. Well, I'll give you a little treatment. The treatment will do. It's going to balance your hormones. It's a very simple treatment, but very strongly effective. It actually, it's like reflexology on the ear. Do you massage the ears at all?
No, I do the hand and the feet.
The hand and the feet.
Well, I do the traditional reflexology where you're on the massage table.
Right.
And I also do what is called VRT.
Okay.
Which is vertical reflex therapy.
Okay.
Because they found that when you are weight bearing, for some reason, the healing process is much quicker. They don't know exactly why, but it has something to do with being weight bearing, where you're standing up and you have the pressure of your feet on the ground.
Wow.
Yeah.
That's pretty
So
cool.
I combine the two together. So let's say if you have an injury, or even let's say you have a stiff neck or something with the shoulder. Okay, I would do your BRT first, and then I'll do the traditional on the table, and then what I'll do at the end is I would work the feet and the hand in either the shoulder or your arm area together simultaneously,
Wow.
and loosen it up,
That's great.
and gets the energy going.
That sounds good.
Try and get that stagnation out of.
We're gonna have to get your business card.
So, yeah, it's cool.
That sounds
But-
cool.
But when I went